So I want to say thank you to everybody for joining us today for this webinar about the Partnership and Innovation Accelerator Pilot Grants for NJAX. The impetus for this particular webinar came out of last year's experience with our first round of applications. We created a series of question and answers that are pretty common. And then actually within the last 2 weeks, there's actually been a new opportunity that I'm going to talk about to partner with the Chancellor's Office here at RBA Chess to make additional awards. And so we thought it would be helpful to all those who have interest in applying to the two mechanisms to be able to spend some time today to talk about both of them and to talk about what they have in common, as well as some of the idiosyncrasies to the two mechanisms. So today what I'm going to do is I'm going to take you through a few different areas. So the first thing that I'm going to do is I'm going to talk about the two mechanisms that we have, which are the NJAX, New Jersey Alliance for Clinical Translational Sciences Partnership and Innovation Accelerator Pilot Program. And then I'm also going to talk about a new mechanism which was just spurred about 2 weeks ago, which is the RBA Chess Advancing Health Equity and Social Justice Pilot Grants. I'm going to talk about those two mechanisms. We are doing them together and we are administering them together through NJAX. I'm going to go through who should apply and who this is relevant for. I'm going to talk about our requirements and the criteria for review, some of the regulatory pieces that are involved with it. I'm going to go over a few of our previous awardees and talk about some things that may be helpful to you as you think about formulating your own applications. And then we're going to have an opportunity for question and answer. So just some housekeeping pieces here. We will have the opportunity for individuals to ask verbal questions at the very end of the presentation. What we're going to ask for, though, throughout is if you have a burning question or something that you want us to address that we aren't addressing in the content, if you can use the chat feature here to send your questions to everyone. Brittany and our staff are going to be looking at the chat and then also sort of pulling this together. So the first part of our Q&A is going to be going through some common questions and answers that we've already been asked about the mechanisms. Then we're going to move to the chat items. And then anything that's not resolved in either one of those, then we'll have the opportunity for you to ask questions verbally. So that's the format of what we're going to be doing today. So without further ado, let me move into the different pieces of this. So the overview of the mechanisms. So the Partnership and Innovation Accelerator Pilot Program is one that we created through NJAX, and the goal of it is to facilitate collaborations between our academic researchers and community organizations so that they can work together on topics that are of importance and mutually beneficial. So some examples of partnership activities could be that you're working with a community group trying to understand what are the needs that are around a particular health problem. So you might want to propose some sort of needs assessment. Another way that you may want to actually work together with a community group is to think about sort of what is the environment and doing a scan to see sort of what is the local context that's impacting on a particular health issue. We've also had different projects that have looked at facilitating activities around community readiness to address a particular problem. And then we've also seen sort of more traditional pilot projects that have looked for data to collect with engaging a community partner so that they can demonstrate potential impact for future funding. Another way that you could use this particular mechanism is to facilitate meetings and events to engage collaborators. So if it's a new group that you're working with and you need to actually bring people around the table around a particular topic, this may be a mechanism to help facilitate that. All of these activities are within sort of the realm of what's possible and what we would expect in terms of the types of applications that we would want to see and are interested in seeing for this mechanism. In terms of the mechanism, it is a small grant. So this is a $10,000 starter pilot. It's for 1 year of funding. And the funding should really be used to support preliminary research activities. So some of the things that you can use funding for would be to pay for incentives for participants. You can use them for costs that are associated with different evaluation pieces. You can use them to purchase supplies, education, curriculum. Also, they can be used for staff, research, students, pieces. However, there are some restrictions in terms of the funding. And so for us, we don't do F&A. It's not included as part of this. So when you're putting in an application to us, we do not pay for indirect costs out of this. As well, we don't support operating salaries. So PI salaries, co-investigator salaries, and as well salaries for regular administrative support cannot be charged against one of our pilot grants. And then also, if you have something that's already funded, we can't then pay for additional funding for the same program. So, and then the final area that we have some restrictions on are journal fees. So if you are needing funding to pay for journal fees, the funding from this particular mechanism cannot be used for that purpose. So that's the NJAX Accelerator Grant. As I mentioned earlier before, there have been a number, and everybody has sort of seen the news and looked at a lot of the different things that are happening in terms of the Black Lives Matter movement and the different disparities that we've seen from COVID-19 in terms of its impact on communities of color. And so RBA Chess, in an initiative with our diversity and inclusion Vice Chancellor, Gita Lambda, we were able to find additional funding to help to move forward projects that are community engaged, that are actually going to review and look at how do we move forward health equity and social justice issues, and really help RBHS to move beyond sort of move from our core community values and actions to really think about how do we move out into the community and engage with our diverse New Jersey populations. And so in addition to the funding that we have available through our CTSA NJAX, there is an additional pot of money, which I'm going to call the RBA Chess Pod at this point. It's the Advancing Health Equity and Social Justice Pilot Grant Mechanism that we have that is also $10,000 for 1 year of funding. And the goal of that mechanism is really is very similar and sort of complementary to what we've been doing through NJAX, and that it's focused on community outreach strategies for our New Jersey populations. The goal of it is to really improve our population health, focusing in on community-based research that empowers teams to think about and promote health equity and social justice. So same amount of funding, but coming from a different pot, coming from the RBHS Chancellor's Funds. That particular mechanism is only open to faculty members who are in RBHS. And again, it's very complementary to the NJAX pot in that our goal is to support the early development of projects and new collaborations with the community and focused around health equity and social justice issues. So for the RBHS pot of money, there are 3 areas or 3 general emphases that we're looking for applications in. And the first one is looking at novel approaches for advancing equity and reducing health disparities in our New Jersey vulnerable and marginalized populations. So particularly focused around underserved groups and racial inequities. So that's the first area. So if you're working in that area, that's one that may be of interest. The second area that the RBHS pod is looking to generate interest and some submissions from is to implement policies, partnerships, and practices in New Jersey that help to advance health equity and social justice. And then the third area that they're looking for applications in is to actually evaluate and monitor strategies that help to reduce health disparities within New Jersey. So looking at how do we measure both short and long-term outcome measures, and looking particularly at differences between advantaged and disadvantaged populations. So I've outlined two different mechanisms, and one question that you may be asking yourself is which mechanism is right for you. So the first answer is you actually can apply to both mechanisms with your one application. So if the particular topic that you're addressing addresses an area within the 3 areas that have been identified by RBA Chess as core and important for their mechanism, as well as also crosses over into the NJAC's PIAP mechanism, you can designate in your letter of intent that you would like to have your application looked at for both of those mechanisms. So you can apply to either of the mechanisms, or you can ask that your application be considered for both of them. If you do receive a fundable score, then you will receive funding from only one mechanism. So the total amount is always only going to be $10,000, and it can come from either one of those mechanisms. But you do have the option, if your application is addressing the criteria for both of them, then you can ask that it be reviewed for both of them and that you could get an award from one of them. So the main things where they sort of are very similar is that if you want to build a community partnership, this is a great mechanism. Either one would be fine for the work that you're proposing. As well, both mechanisms are really focused on this being the first step in moving towards independent research funding. So both mechanisms are really interested in seeing work that is going to seed an application that will go to a larger external funder. So in the example of NJACS and our PIAP, we in particular are interested in NIH funding going to one of the NIH institutes. As well, we welcome and are interested in applications that may go to PCORI, the Patient-Centered Outcomes Research Institute, or Robert Wood Johnson Foundation, or other groups that are doing peer-reviewed applications. But the goal for both of these mechanisms is that we want to make sure that whatever we're doing with our community partners is something that this is used to catapult to the next level, so that we're bringing additional resources to bear around the pieces. Where the two applications differ, again, is if you are RBA Chess faculty, you can apply to both of those mechanisms. NJACS is a consortium between Princeton University, the New Jersey Institute of Technology, and as well Rutgers University. And so anyone who is a researcher within one of those settings is eligible for the PIAP grant, and there are no restrictions for that. As well, you'll notice, and I'm going to go through some examples from our work previously, there's very specific wording in the RBA Chess pilot mechanism that says that projects have to focus on New Jersey vulnerable and marginalized populations or underserved groups with racial inequities as a project focus. So if your project has one component, but maybe not all of those, you may want to focus in on a PIAP grant. We do not have that as a particular requirement. However, certainly projects that are addressing these issues, we would be interested in and want to take a look at as well. But if you're focusing in on a New Jersey vulnerable population and you're an RBHS faculty member, you may want to look at the RBHS mechanism in addition to the PIAP. So those are sort of the differences between the mechanisms, and I'm happy to take specific questions from people at the end as we sort of go through, but I wanted to sort of try to screenshot for you the differences as well as the similarities across the mechanisms. So those are sort of the key differences, and now everything else is pretty much the same for the two mechanisms. So I want to start to go through some of our key deadlines and other pieces here. So things that everyone should know. We released this application a few weeks ago in middle of June. The letter of intent is actually due in August 7th, and that's required. It's a one-pager, and I'm going to go through what we're going to be looking for in terms of the content on that, but it's required so that we can understand who are the reviewers that we need to line up, and as well that we have the capacity to review all of the applications in a timely fashion. The deadline for the actual application is Monday, August 31st. We will let everyone know we're going to keep a very tight deadline on this and get all the reviews and everything done within a month. So we're looking at hopefully the top of October, but latest the end of October, to let everyone know about awards. And then the earliest start date could be October, depending on approval. So this particular slide is based on the PIAP program. So we have an additional level of review from our funder, NCAT. And so applications that are awarded through that mechanism may take a little longer to actually get the funding out the door. But those that are going through the RBA Chess mechanism, as soon as those applications have been decided and have been approved by the Chancellor's office, those will be awarded immediately. So who should apply? So in terms of this, I think I talked a little bit about it before, but for the PIAP mechanism, again, it's open to anyone who is part of the NJAX consortium. So those are Rutgers, Princeton University, and NJIT individuals can apply for funding. Also, you have to have at least one community partner and at least one academic partner. So it could be that you have, you could do dual PIs on this, where the PI, you have a community partner and an academic partner. You could designate just one PI, and we sort of leave that up to the individual groups that are applying to make the decisions about what their leadership structure makes sense and what they think is most important. But we really want to make sure that you know that you have to have a community partner to be able to apply for this mechanism if you're an academic who's applying for it. You do not have to have an existing partnership. So these applications can be to help to develop a new collaboration with a community organization. It could also be used to further deepen relationships with an existing group. So there are no restrictions in terms of the type of relationship. The main thing sort of to take home from this particular slide is that you have to have a community partner as part of the application, and you have to have, for the PIAP mechanism, it has to be at least one of your investigators is part of the NJAX consortium. So we have had questions in the past of, if I'm from Rutgers, do I need to have somebody from Princeton as well as NJIT on my team? The answer to that question is no. While we think that would be great if you could actually pull together a consortium like that, we know that all projects don't sort of lend themselves in those ways. So as long as the PI or one of the co-PIs is from one of the NJAX institutions, then that is fine in terms of being able to apply to this mechanism. And again, for those of you who are looking at the RBA Chess mechanism, the PI needs to be an RBA Chess faculty member. So defining a community partner, what do we mean by a community partner? For our purposes, we are looking at partners who generally are nonprofit status, that are part of community service as part of their mission, that they're embedded within communities. We take a broad definition of community, so it could be a community that is geographically located. It could be a community of individuals, so for example, cancer survivors, or it could be around diabetes or heart disease. So community is broadly sort of construed. There are a number of different agencies that fit into this definition. So groups like federally qualified healthcare centers, physician practices, other organizations could also fit the category of community partner or community co-principal investigators for our particular mechanisms. Where there is some overlap, however, is if you are working with a community, you're working with a FQHC, for example, within the RBHS system, then that particular group would not count for this mechanism as a community partner. We're really hoping that with this mechanism that we can see real deep sort of relationships and coalitions that are built across communities. And so we want to get beyond our Rutgers, NJIT, and Princeton footmark. And so we really want to see community partners who are engaged, who are beyond the borders of Rutgers, Princeton, and as well NJIT. So at the bottom of this slide are some examples of community partners, and we can talk through some others as we move into the Q&A session. But groups like the Hyacinth AIDS Foundation or New Brunswick Tomorrow, Sister to Sister Breast Cancer Group, the North Jersey Community Research Initiative is a group that we've worked with. There are a number of different groups that are out there who you could choose as community partners, and a plethora that I haven't listed that probably would fit the bill. So in terms of our proposal requirements and the criteria for review, you have a letter of intent. Please make it no more than 1 page. And what we're looking for is the minimal amount of information on this page. So we need to know who's actually doing this as the principal investigator, their title, their contact information. We need to know information about the partners who are involved. So the academic partner as well as the community partner. If you can provide a very brief sort of summary of what the mission and experience is of the group or any previous collaboration, or if it's a new collaboration, sort of what was the impetus for it and the reason for soliciting this opportunity, that would be very good information to put in the letter of intent. The other piece that we would like for you to put in the letter of intent is to let us know which opportunity you're applying for. So because we're using the same application for both the RBA Chess mechanism as well as the PIAP, we just need to know, in terms of the different pots and the different types of reviews that we'll have out there, how many reviewers that we're going to need to pull together. So please let us know what opportunities you would like to apply for. Also, the letter of intent deadline is on August the 7th. And again, in order to be able to submit the full application, we really need to have your letters of intent in by that deadline. So in terms of the application materials, we need those to be submitted to our group by the end of August. So from the letter of intent going into the end of August, you have approximately a month. And even now I would get started on all of these different pieces. Formatting recommendations are very similar to those that you would find in an NIH application. So 11-point font, something that's legible, half-inch margins. The proposal should be submitted in one PDF. So I'm going to show you on the next slide sort of the materials that will go into that, and we can take detailed questions about each one. There is an application form that you can download off of our website, and then in addition, the other materials should be put into one single PDF and emailed to our group, and we'll provide the contact information in subsequent slides. So in terms of what we're looking for, there is a research strategy, what we call a research strategy, and it boils down into 4 different components. So this is a total of 6 pages, no more than 6 pages. If you're able to do this in less than 6 pages, that is fine too. What we want to see though is there's some sort of abstract that describes sort of the overview of this partnership that you're proposing. What is the community health concern or research question that you're hoping to address through this partnership? And that should be no more than a half page. Then we would like you to give some specific aims, and that's really to describe how this project's going to actually improve the ability of you and your organization, your partner organizations, to engage in research in the community. And then describe what the main components of your project are. So again, a brief half-page summary of what is it that you're planning to do and why is this important. You have the opportunity to put in background information that you think is going to be relevant for review. We recommend no more than 2 pages of background information. And again, if this is a new partnership, you may not have preliminary data. It really depends on the project that you're proposing. But again, you can have up to 2 pages where you sort of talk about the problem, talk about your community, talk about the relationships that you have, and build the case for why this particular project needs to be done. And then in the research plan, we want to see a clear description of what it is you're planning to do. What outcomes or milestones do you think that you're going to achieve? And what's the impact of this project, either for the next project coming down, so I'm going to apply to NIH, or I'm going to apply to RWJ or some other group. What kind of data am I going to be able to get out of this project to be able to show and provide feasibility for the next step? And then the second piece of this is also talking about sort of the future of your collaboration and what are some of the plans for sustainability. So we recognize that this is a very small amount of money, and it's really meant to be sort of an incubator. And so to the degree that you can talk about, you know, different groups within your contacts that are interested in this, would want to help move it forward, and can talk about the ways in which you see this being sustained, that will help very much in terms of the review and the review process. So those are sort of the key components of the research strategy. Then in addition to that, there is the, you know, how is this going to lead to sustainable funding? So we've gotten in the past sort of a generic, I'm going to apply for another grant in NIH, but it would be really helpful. And again, it doesn't have to be a full page, but really sort of being able to talk about, here's a particular mechanism that I'm interested in applying to. Here's how this kind of data or this partnership would help to position us in a way that we would be competitive for that funding. That kind of information would be particularly helpful in the reviews for projects. A project timeline, I always love to see a great graphic there. If you can just sort of tell us month by month, what is your timeline going to be? What are you thinking about in terms of this? And what can we expect to see? And then if you have references, then this is again not part of your 6 pages, but if you have references that you've cited in the application, then just append pages as you need to. As well, there's a resource and environment page, but again, we would like this to be very brief to give just sort of an overview of the partners and the organization history, current work in the area, and what are the resources that you're going to be leveraging within your setting. If you have others, oops, sorry about that. If you have other support, feel free to include that, but it's not required. We will want a detailed budget, and so for those of you who have questions about that, we can go into that a little bit later. But basically, we need to know the amounts for salary and non-salary, and then what you're planning to do with those different pieces. And then for the individuals who are going to be really key partners on this particular project, we need to see resumes for community partners, because we know that sometimes formatting into the NIH BioSketch format can be challenging. But for those of you who are researchers or in an academic setting, we'll expect to see your resumes in the NIH formatted BioSketch form. So those are the major components. Oh, and the last piece of this is letters of support. So if you're working with multiple groups, we would want to see that they actually are working with you, that they are part of the project, and that they're committed to it. So no more than a page, but always helpful to have a letter of support from the groups that you're working with or that you think may be impacted by the project that you're proposing. So in terms of the ways in which we review this, What we will be pulling together is a committee of academic and community members who are going to be reviewing all of these proposals. And so that's one of the reasons for the letter of intent. So we have a sense of who and what content areas we're looking at, and as well, what information do we need to be thinking about in terms of making sure you get the fairest review as possible. We've asked our reviewers to focus in on 5 main areas. And so these are the main criteria that your application is going to be scored on. So the first one is this topic important to the community that you're actually saying that you're going to be working with, and to broader communities more generally? So again, the goal of this application is to really ignite applications and data and provide information that would be competitive for external funding. So not only do we want to understand what's going on in your particular setting, but how can that actually tell us something more about what's going on more generally? Also, can you meet the goals that you've set out within the award period for the funding that you're requesting? That's really important. So it's got to be feasible in order for this to be doable from our perspective. I'm going to go over some of our guiding principles for community engaged research, because in addition to questions about what is a community partner, I know a number of people have questions about what is our definition of community engaged research. So I'm going to spend a little bit of time talking about that in the next series of slides. And then looking at your budget, is it complete? Do we know how you're actually spending your funds? So if you say that you need a $9,000 budget for supplies, but then don't actually tell us what those supplies are, that makes it difficult for reviewers to actually be able to judge the veracity of the application. So making sure that your budget is complete and that it's actually meeting with the funding guidelines and is reasonable to accomplish your goals is really important in terms of review. And then again, as I've said before, does this project have potential for independent or sustainable funding? So what's the next step after this? And is this going to move towards peer-reviewed funding or funding in some other setting? So those are the 5 criteria that our reviewers are going to be looking at for your applications and be thinking about in terms of the awards. So in terms of the principles for community engagement, the NJACS is part of a broader consortium of clinical translational science awards across the country. And so we actually have used the guidelines and the guiding principles that were adapted by the University of Rochester's Medical Center for community advisory boards. Those guiding principles are actually listed and detailed in the RFA application on the last page, but I'm just going to sort of hit the highlights of what we're thinking about when we say these different terms. So long-term engagement, we really want to see that you're actually, if you're building a new community partnership, that there's a goal for this to be a long-term engagement and not sort of a one-and-done project. And if you're working with a group that you've worked with before, then really talk about sort of the value added of this new piece that you're proposing. Mutual benefit. The application and the project needs to benefit not only the investigator or the researcher coming from the academic setting, but it also needs to have some benefit for the community group. And so being able to demonstrate that in the language that you use around the way that you frame your application is really important. And as well, mutual respect for community members. We want to see projects where researchers and academics are working together around sort of sharing their findings and having mutual respect for each other, and actually listening to and engaging and reflecting upon each other's conversations. So we want to see something that's bi-directional and not unidirectional. So it's not about us as academics coming in and saying this is what we want to see done, but we actually want to see that there is a shared relationship there and some shared responsibility. And then evidence-based. So the goal of all of this work is really to think about how do we bring the best practices to bear to our different communities. And so whether you're proposing to gather information to help disseminate or implement evidence-based strategies, or you're gathering information to try to create a pilot for something that might be an intervention down the road, we really want to see that, you know, the best efforts are made to address sort of the evidence, and that this work is going to contribute to that. And again, as I've said before, sort of collaborative from start to finish. So we don't want the community partners to feel like they are sort of an afterthought. This really should be collaborative from start to finish. So as you're thinking about your ideas and leaving this meeting today, thinking about even, you know, I have an idea. What do you think? Can we talk about this in this virtual space as opposed to meeting face to face at this point? And then really sort of thinking about how their perspectives inform and shape the work. And again, we want the work to be responsive to community priorities and their perspectives. So these are the things that we are looking for in terms of community engaged research. And, you know, different projects will lend themselves to different pieces of this. So this is not a checklist where you have to say, I've done every single one of these things. I think people need to be reflective and thoughtful about how their projects work together. But certainly projects that are able to hit, if not all, but most of these will certainly fare better in terms of review and the criteria that the reviewers are going to be looking at than applications that don't. So in terms of regulatory approvals, not all of our applications are going to require a regulatory approval. However, if you're proposing to do something that has human subjects research in it, so say you want to do a pilot study of some sort, you're going to do surveys or interviews, and you're planning to publish off of that, then certainly you're going to need IRB. And for any application that's going to be seeking IRB, we recommend that you actually put it in at the same time that you put in the application. So just for everyone to know on here, in order to get the funding from our mechanism, we need to see IRBs in place before dollars can leave and move to the PI. And we're willing to work with you in terms of timeline on that, but the sooner it happens, the better it is. And in our previous group of awardees, there were some applicants who actually had some human subjects pieces and others that didn't have human subjects. So again, it's going to depend on the project that you propose and the different things that you want to do with your community partners. But if you do have a human subjects piece to it, then you will have to go through the IRB. So with that, I'm going to talk very briefly because I want to make sure that we make it through any questions and get to the interactive piece of this. Last summer was our first group of awardees, and so we had 4 applications that received about $10,000 each from different parts of the NJAX consortium. So I'm going to go very rapidly through these projects and then point out a couple of things to you about some of them. The other piece of this is that if you have questions about different projects and want to be networked, please let us know, because we would be happy to make inroads with investigators who have been successful in this area to be able to talk about their experiences with the mechanism. So the first application that I just wanted to highlight here is a diabetes prevention program for South Asians, and it's with the South Asian Total Health Initiative and Robert Wood Johnson Medical School as the academic partner, and the PI is Usha Ramachandran. They received $10,000 from the mechanism to focus in on the Central Jersey area and the South Asian community in particular, focused around diabetes prevention. And this particular project actually did not have a human subjects component to it. They were actually modifying a curriculum for South Asians and looking at planning implementation. And so the focus of this was really around sort of building up their curriculum and making it culturally relevant and working with SAFI to actually achieve that with the community. So this is an example of a project where we didn't actually have human subjects that were involved in it, and was funded but brought in a community partner from the beginning, where they really sort of pulled together this curriculum and said, how can we adapt it and make it more relevant for our community? So this is an example of a project that you may think about. The next project here is the Healthy Air and Healthy Eating, Encouraging a Culture of Health in Elizabeth, New Jersey project. And that's a collaboration between the Rutgers Center for Environmental Exposure and Disease as the academic partner, and Groundwork Elizabeth, which is a community group that's really focused around environmental pollution, asthma, and issues that have become really important because of diesel trucks in the Elizabeth neighborhoods. And so they actually proposed a community gardening program that they're working to assess their local air quality and the potential effects on asthma. And so again, they've decided to pilot some integration with Groundwork Elizabeth into this program to really sort of better understand what's happening within the context of a broader project that had other funding. So this is another example of a project for which you may or may not need some IRB regulatory pieces. The next two projects actually did have IRB. This one is funded in Newark. It's Pamela Rothplatz-Puglia is the PI on that, and it's through a partnership with the Leaguers, which is focusing in on food insecurity and obesity issues. And this particular project proposed a needs assessment of family functioning around food-related behaviors. So focused on our low-income racial ethnic minority families in northern New Jersey and around child and maternal health issues. So they did need IRB, they put in an IRB application, we're able to get that done, and we work with them on the timing and timeline on that. And then the final project that I'm going to highlight that was funded last year is one that was focused around the LGBTQI population and cardiovascular disease. So looking at a group that has higher rates of exposure to tobacco, obesity, and other sort of health behaviors that are associated with higher cardiovascular disease risk. They worked with the North Jersey Community Research Initiative that's based in Newark, New Jersey, to develop basically a pilot study that's looking at cross-sectional diet quality and cardiovascular risk factors for a population of adults with their partner. So this is much more sort of the pilot study model that we've seen in other settings. So as you can see, we've had a variety of different groups that have been funded through this mechanism, and we're hoping to diversify that even more this year with the additional funds. And so with that, I'm going to go to a few sort of frequently asked questions that we've already gotten that I'm going to talk about, and then we can move into those that are in the chat. So the first one that we've gotten is, what's the difference between the partnership, the PIAP program, and the Advancing Health Equity and Social Justice Pilot Grant? So I'm going to go back to my slide again, which is the major difference is that the RBA Chess mechanism is just for RBA Chess faculty. The PIAP is open to anybody in the NJAX consortium. There's very specific population that the RBA Chess mechanism is looking at, and we don't have those population restrictions for the PIAP grants. However, as you saw in our previous slides, many of those grants actually probably would have been relevant for the RBA Chess mechanism. So, so as long as you're wanting to build a partnership and then use this funding to move forward for external funding, these mechanisms are right for you. So do I need a partner from Rutgers, Princeton, or NJIT? So the answer is for the PIAP, as long as you are from one of those 3 organizations and have a PI who is from one of those organizations, you can apply. You don't have to have one from every single one of those organizations. So you just need someone from one, not all. And again, the RBA Chess Mechanism is only open to RBA Chess Rutgers faculty. So does a project need to include a community partner, and where can I find one? So the answer is yes, and we talked a bit about what we think of in terms of what we're looking for community partners. If you have an academic question that you're interested in doing something with, but you may not necessarily have inroads into different community partners, you can certainly work with our engagement core. One of the primary things that we are here to serve in the capacity of is to actually partner researchers with community partners. Likewise, if you're a community partner on this call and you're looking for a researcher to partner with around a particular topic, we also work in the reverse direction. So if you are looking for a research partner, either a researcher in your community group or you're a researcher and you're looking for a community group, certainly reach out to our engagement core and we will work with you to try to find the appropriate people for you to network with to be successful in this mechanism. And then what is considered a community partner? I think we really sort of addressed that earlier, and I'd be happy to take clarifying questions from those who have questions in the chat. But again, we're looking for nonprofits, 501c3s that are really in the community and are going to extend our reach beyond sort of the Rutgers, Princeton, NJIT footprint that we already have. Do I need to have IRB approval before applying? So you do not need IRB approval before you apply for our pilot grant, but again, highly recommended to put in the application soon afterwards, so just so that you have it in process. But you do not need to have IRB approval before applying. And then the budget cap for both of these mechanisms is $10,000 total direct. And again, we've talked about some of the restrictions around that, and no salary for PIs or co-Is in terms of the academic partners. So with that, I'm going to open it up for questions. I want to point you to a couple of different places. So on our, and you'll get these slides, we'll make them available after this Q&A. And as well, the website will be updated, but you can get access to the PDF for the application on our website. We are going to link to the RBA Chess Mechanism on our website so that you can get access to the specific RFA around this. And if you have any particular questions around this that we don't get to during the Q&A, or during the verbal Q&A piece of this, then please reach out to us at NJX Community at our email here on this slide. So with that, I'm going to stop sharing, and then we'll start to take questions. So Brittany, I'm going to ask you to throw out questions that we have that are here.
Sure. So we had a couple in the chat. The first one, is the Rutgers School of Nursing Camden considered part of RBHS for this mechanism?
I believe the Rutgers School of Nursing is part of the Rutgers School of Nursing, and so that is part of RBHS. So the answer is yes, but we will double check that for you.
All right. The next one, approximately how many PIAP grants do you anticipate awarding this year?
So right now we are looking at about 3 to 4 PIAPs, and then depending on the quality and caliber of the RBHS mechanism, we don't have a ceiling on the number of those at this point. So that's going to be up to the Chancellor's office.
And the next one, would it be possible to share the % of 2019 funding applications that were ultimately funded?
We do have that information. I'm not sure that we have it today, but we can talk about that later on and make it available. It is very competitive, though. We had 24 applications last year, and we funded 4. So we can do the math on that one.
Okay, and then a question about community partners. Can the application include a non-New Jersey-based community partner to support grant activity in New Jersey?
Yes, so it can, but again, you have to be very clear about the specific New Jersey question, the community that you're going to be addressing, and again, depending on which mechanism, you just need to be very clear about how they're going to address the New Jersey issues. But there's no restriction that it has to be internal to New Jersey.
And then the last one, should we assume that COVID-19 will prevent us from doing in-person meetings with our community partner or interviews with community members?
I would assume so. So, I mean, much of what we're moving towards in terms of our community engagement strategy has been Zoom and building capacity to do more online virtual. And so I would assume that any application that comes in, you should be attentive to what the current context is, and then think about how that's going to potentially impact over the next year.
Okay, that's everything in the chat.
So are there other questions? So I will have to check on the Rutgers School of Nursing piece to see whether or not they fit as part of RBHS. So we will push that back because I know that there are some distinctions in terms of Camden. So we will take a look at that, and then if there's an application coming in from that particular mechanism, again, really important to get in the letter of intent so that we can be in contact with you about it. So if there are not questions, then we will keep this open for a minute or so. But if there aren't any other questions, again, we thank you so much for your time and for joining us today. If you have other questions, please feel free to reach out to our Community Engagement Core, and we will get back to you about that. And thank you for your time here today.
Shauna, you have another question in the chat about whether or not people will get a response after the one-page LOI.
So I will say, assume that there is not going to be a response. The only time there would be a response is if there is going to be a question of clarification about mechanism. So if there's a question about mechanism or the issue that we just had come up in terms of nursing or other things, we would then go back to you. But assume that there will be not a response. The response will be that we received your letter of intent. Thank you. Okay, with that, everyone have a fantastic day.